Hello, my name is Ava Brinker, and this is my video interview for St. David's School of Nursing at Texas State University. Question 1. I chose St. David's School of Nursing not just for its grades or because it's the nursing school at Texas State, but because of its sense of community. I chose the school because of an emphasis on its compassion and empathy and understanding of its patients and its teachings. When I was looking at schools, junior and senior year of high school, that was one of the most important things that I was looking for. Not just a place with good grades, but somewhere that had a good foundation, a good basis that they were teaching off of, and good morals. And I found that in Texas State's nursing school, St. David's. How I've been prepping for the nursing school has been doing my due diligence and completing all of my prerequisites. I've done most of my prerequisites, well, all but one, chemistry, at Texas State, including biology, A&P, and your more basics, like history, writing, math, communications, and philosophy. Next question. I'm going to be talking about an experience I had last year in the second semester with one of my classmates in my HDFS class, or my lifespan development class. And this class is a pretty big class, about 150 to 200 students. And we were all split up into groups about 5 or 6. I was in group 3. And in this group with me was my classmate Magali. Magali informed everyone in our group that she had epilepsy. So she had a history of seizures, and she told us what to look out for, her symptoms, and who to contact if anything were to happen. Of course, we weren't really expecting anything to happen, since Magali was medicated for her seizures, and she took proper medication, and every time she felt like something was coming up, she made sure to take the steps that she knew to calm herself down and to get out of that space. So, it came as a surprise when, about 2 weeks before finals, we were going over some lectures in class. All of a sudden, everyone surrounding her, including myself, heard a very sharp, loud intake of air. Magali, who sat 2 seats in front of me, started seizing. In this moment, of course, we all froze. No one really knows what to do. Of course, as her group mates, we had been informed of the signs and what to do in that situation, but we're not professionals yet. So, in this moment, everyone freezes. And of course, in moments like these, you're thinking, oh, who's gonna react? Or you're waiting on someone to react. And in that moment, I knew that in order for my classmates' safety, I had to be the one to do that. And it had to be soon. So, I immediately stated that we needed to get her off the chair, on the floor, and on her side. One of my fellow classmates started a timer, while another one of my classmates called 911. We were able to ring Magali's emergency contact on her phone, where I then relayed information, medical and personal, to the 911 operator on the other line. Of course, Magali is now fine, but in situations like that, we needed to step up as students and as her peers to respond safely and accordingly. And I think this situation has really helped me not only kind of prep myself for being a future healthcare worker, but stepping up in situations that are hard or scary or nerve-wracking. And I think this situation really put me to the test. Next question. While I don't have much healthcare work experience or volunteer experience, I think I make up for this in my time working in a gym. I know it sounds a little crazy, but I think in a way it ties in a lot with healthcare. As the operations at the UFC gym located in the Houston Heights, my job was to run a smooth ship. Make calls, manage leads, make sure communication is going all right between customers and, coaches. But the most important message about working in a gym is that as coaches and as front desk, whatever your job is in a gym, your goal is always the betterment of other people. And that was one of my big goals while working there for the 3 years that I have. I've learned so much there from my fellow coaches, from my bosses, even from the members at the gym. It's taught me to be a very well-rounded person, how to resolve conflict, listening to my peers, and just giving and receiving constructive feedback. And I think this is really important because as healthcare professionals, that is one of the most important things. And I think one of the most important ties that these two have in common, and how working at a gym has helped me in my hopeful future as a healthcare professional, is that I want everyone to be better. I want people to be safe, secure, and moreover, know what's going on in their body. And I want people to be healthy. And I think working at a gym has really helped me and prepared me for the healthcare field that I'll hopefully be working in the future. And lastly, moving on to my last question. So, we all know in this day and age, 2026, that technology is rampant in our everyday lives. It's everywhere. It's in the technology we use, it's in our communication, but how I plan to overcome these barriers are starting at the root. Establishing rapport with a patient, maintaining eye contact, having open body language, and just making the patient feel overall welcomed, respected, and most importantly, heard. Patients come to us because they sometimes don't know what's going on, or they're feeling scared. And our job as future professionals is to mitigate that and explain everything that's happening. So instead of letting technology run the course, I think we should use it as a support in making sure in patient relationships we have thorough explanation and complete clarity in all the information that we use. And that is my interview. Thank you.